Hey everyone, and welcome to the Women of War podcast, where we dive into the untold stories of women's bravery, struggles, and resilience in the midst of conflict. I am your host, Megan, and together we'll explore the powerful narratives of women who've stood on the front lines, those who have been caught in the crossfires, and the lasting impact war has had on their lives. From ancient warriors to modern day heroes, we'll uncover the roles women have played in shaping history throughout war and peace. So grab your headphones and let's embark on this journey to hear the voices of women who fought battles both seen and unseen. Get ready for an eye-opening experience on the Women of War podcast. Today is part 2 of 4 of our interview. I hope y'all enjoyed. If you have any questions, please put in the comments. And welcome back to the Women of War podcast. I'm here today with a special guest, Tina White. She is a warrior in her own right. She is a caretaker to a cancer patient, in which we will be delving into this episode. Tina White is a lifelong Texian who is 8th generation. Her family has resided in the Lone Star State since before Texas was its own republic. She married her high school sweetheart over 3 decades ago. She homeschooled their 2 children from preschool to high school graduation. Tina has served on boards of directors and executive boards of directors and has volunteered her time and talents since she was 18. She's even won an award or 2 for what she's done for her community. She has degrees in English and history. She's a published writer and photographer, a foodie, unplanned caretaker, and her most important title is that of Mimi to her first grandchild. Here we are with Tina.
Hello, thank you for having me.
Of course. So, you mentioned something about you're about to go into another procedure. Can you go ahead and tell us just a little bit about y'all's journey so far? And
Sure.
Then after this, we're going to get into a little bit more about you as a caretaker and your journey.
Okay. There was a lot of, I want to start by saying this. The first thing I learned about cancer is there's a lot of fear associated with it. There's the fear of the unknown, the fear, we were waiting and waiting. Our particular hospital that's local to us was backed up and very busy, and we were waiting, and I was on the phone with them, the PET scan's going to be when, no ma'am, 2 months is not okay. I don't care. we need this sooner. Yeah. We can't wait two months. And so, and there was just a lot of fear, and, it was a month really before we had the proper diagnosis, even though we pretty much already knew what it was. And whenever he went in for his biopsy, the doctor who did the biopsy told us to pray that it was lymphoma. My answer was, I'm not going to pray that my husband has any kind of cancer. Mm-hmm. And sure enough, it was the multiple myeloma. It was, confirmed. But there was lots of diagnostic tests, but they never did a bone marrow biopsy. But I wanted my husband, if it had been me, I would have gone straight to a bigger hospital with a name that everyone knows works directly, like strictly with cancer patients. I found one in Little Rock, Arkansas, that it only, works with multiple myeloma patients. So that was one of my top two, and MD Anderson was the other one. And around here where we live, I thought everyone had heard of MD Anderson. But I learn every day that not everyone has. We had to kind of lighten the mood for a second. We had a doctor at his next to last hospital stay that he's had this year, 2 hospital stays ago. She said, "And where is this Dr. Anderson at?" But if you know that MD Anderson is in Houston, Texas. But anyway, that would have been my choice. Go straight to Little Rock or straight to Houston. That's what I wanted for him. But he's a man of let's get this done. Let's get this over with. And when we finally got to see the oncologist here locally, we basically were told, oh, well, it's going to take a little bit longer. We're not going to hook you up with chemo just yet. It's going to take time. You just need to be patient. And, meanwhile, we're actually watching a tumor grow out, from right here, where there's usually a hollow right there, and the man's Adam apple is right above it. We're actually watching this tumor grow out of him daily. And, I just wanted to scream, do something about it. And that was my husband's, response as well. He actually took out his pocket knife, handed it to the doctor and said, "Doc, no, here's my vein. Stick the chemo in. Let's get this going." And the doctor's like, no, that's not how this works. And, he may not be used to working on tough Texas men. But he did start here, in our hometown. And that was, like I said, April 10th is whenever, everything happened. And by mid-June, we were already, that's whenever he went to MD Anderson for the first time, and they were great. They get you in within 2 weeks, and you plan to stay a week, and you're just busy with all these tests, and it just moves like clockwork there. There's no waiting. There's, they're very accommodating. It was very nice to see just how they click, how they work, and everything is so interconnected. All of the departments are interconnected there. If you miss an appointment, everyone else knows about it. If you're held up in one department and your echocardiogram is taking too long, well, they're going to let all the other departments know that all of your other tests, you're going to be a little late for them. So that took a lot of worry off of me. I didn't have to worry and try and figure out how to alert all of these other doctor's offices. So that was nice. And this is, mid-June. Mm-hmm. By September, we were moving to Houston for 3 months to embark on his first real. He had chemo and everything locally, but this was the first real big thing, the stem cell transplant. First, there was outpatient testing, apheresis, where they take and remove your blood and take the stem cells from it, capture those, and then put the rest of the blood that they don't use back into your body. And they count them, and they have to have a certain number. And if you don't get enough the first day, then you have to come back a second day and even a third day. But they want to make sure that they have plenty. And anything that's left over, they store for perhaps another one. And there's 2 different kinds of stem cell transplants For a multiple myeloma patient, there is autologous, where you use your own stem cells. Or there's the other kind where if you have someone that has compatible ones, you can use theirs. There's a little bit more of a risk, like at 100 days, there's kind of a little thing that happens with that. But whenever you first go into the hospital, you go in for a whole month. And he had 2 particular kinds of chemo. Now, he had never had chemo of this stature before. It had never been this severe. And the first 5 days, it was okay. That was one kind of cancer, then, or chemo. Then 2 days off. And then 3 days of mouthful. And we knew that one was going to be pretty severe, just because of what he had to do whenever he had to prepare to take the chemo. And he would have to eat ice 30 minutes before, all the time during receiving the chemo, and 30 minutes after. And the reason is it can cause blisters in your mouth down all the way through. It can cause blisters, and so you're freezing that area so it won't blister. He almost escaped without any blisters, but had one on kind of where his voice box is, where his Adam's apple is, like right where you swallow. So he was in the fetal position for 5 days and couldn't swallow. They gave him a suction tube, and so he would use that. And thankfully we have been together for so long and married for so many years, because whenever they came in and asked him a question, he couldn't speak, he wouldn't speak, and so I would have to answer for him. It's odd enough being kept in a room without being able to go outside and feel the breeze or hear leaves rustle or anything like that. That was an odd part of being in the hospital for a month. And I had researched and looked to see, what do I need to bring into the hospital with us? What do I need to pack? What do I need to buy? What do I need to get? What do we need with us? And I think the best thing I brought was my tea kettle. And I would, of course, offer hot tea to any of the doctors or nurses that, medical staff that came in. And of course they all have their masks on and they can't. But a few did, they would accept a cup and take it to their, room where they could drink at. And so they would, thank us. But that was probably the best thing that I brought, was that. And I think other than that, it probably would have been a mattress, would have been the best thing I could have brought, but didn't. So after he had the stem cell transplant, and there were issues with that, things that we didn't know would happen, like lots of blood products that he had to have, blood transfusion, platelet transfusions. Those are very normal afterwards, and he would have to, have those quite often sometimes. And during one, he had an eye bleed in 3 different places in one eye. And thankfully he said something to me. I notified his nurse. Come to find out, she was a traveling nurse and should not have been administering blood products.
Oh.
We had a little bit of trouble getting her to contact the doctor, a part of our medical team that we met with every single day, sometimes a couple or 3 times a day, depending on what was going on that day. Had a little bit of a bumpy road trying to get a hold of the doctor, because she was the avenue that would get us to that doctor, and she was the one that kind of messed up. So we did finally get to speak with that doctor, and of course, they have every doctor there. We didn't even know they had an oncology dentist. Like, he had to see a doctor, a dentist, that specializes in oncology dentistry. So that was kind of cool. But, and honestly, to kind of go back for a minute, whenever the cancer eats the bones and the holes that it leaves, those are called lesions. And so they say the lesions only affect the long bones, your arms, your legs, your spine. But he has lesions skull to toes. And whenever we were looking at the x-ray with the dentist, I asked him, do the lesions show up? Would a dentist have been able to catch this? Only if he was, educated in oncology, dentistry, would he have known that those were lesions that he was seeing in the dental x-rays. But I did find that was very interesting.
I agree. That is a very interesting fact.
That is a very detailed part of dentistry that never knew happened or, was there. I forgot where I was. I took that little rabbit hole. So they have all kinds of doctors there. So they had an ophthalmologist there. So, got him set up with an ophthalmologist. This, of course, happened on a Sunday. But on Monday, we spent all day long in the ophthalmologist clinic. And they checked him out thoroughly and everything like that. And basically, there was 3 pools of blood in his eye. And we just had to wait. And the body would absorb it. It was in his view, his line of vision. So if it hadn't have been, we would have never known. We would not have known that had occurred. But because, it did, we were able to find it. And the last little bit, 6 months later, there was still a little piece there, a little remnant, but the doctor said it was a piece of cholesterol and it would just take a little bit longer to be absorbed, and it's gone. There's none of it.
Oh, good.
We couldn't see it. It wasn't visible to us, but the ophthalmologist did her test and everything. Of course, she was able to see it right away. But I think that just speaks to how encompassing everything is there. Like, they can take care of everything. We were about to get to be released, and we could not leave the floor. And I say we because that included me as his caretaker. They want the patients to have a caretaker, and if I were to leave, then I would not have been able to return for 24 hours. Mm-hmm. And funny enough, whenever that eye bleeds happened, I had something that I needed to go to the doctor for, and if I would have left, I would have not have been there for, to help him with any of that. But I think my kids reminded me that I could have a visit over the phone with the doctor.
Yes.
And so because of that, I didn't have to leave him, and I didn't have to be gone. And if anyone's watching this right now, they're saying, oh, that's not the protocols now. Well, this was in 2022, and this was the protocols then. I think they're a little more lax now. You also have to realize that we're basically like in an ICU. We don't want any germs in, because they had to wipe out his immune system. Wipe it out so far that after the stem cell transplant, he was supposed to have his childhood vaccines again, because just wiped out to completely nothing. And we were getting ready to be released, and then all of a sudden the yellow gowns came out. The yellow gowns mean isolation, and that means that anyone coming in has to put on the yellow gown, the mask, the gloves, and booties. And even the food service people that bring you the food would have to don all of that attire, that special attire, because of being in isolation. And he spiked a fever, and so we had to stay in the hospital a few more days than what we anticipated, and that was really hard because our kids and grandbaby were there to see us and visit, and we couldn't really come in, and that was a little disappointing, but not anything that couldn't be overcome, and just a little bit of patience and waiting, and he got released. So we stayed in our nice apartment a couple more months, and actually went home a little early. We had one appointment left, and that's something we could have had taken care of at home, and he just wasn't doing anything. He was miserable. He wasn't at home. He didn't have anything to tinker with or do. He just had a chair and a TV to sit in, and a bed to lie in at night to sleep in. And there was, a beautiful green space outside that we could walk in and play cornhole, but that just didn't interest him. He was tired. He was tired, and his body was busy rebuilding everything that had been torn down. And one of the things that we weren't sure of is, okay, so he's had this chemo, when he lose his hair. We thought it would be immediate, but it took time. But I was able to shave his head because he wanted that taken care of. And but whenever you run that terry cloth towel across the hair on the arms, it kind of gives a Velcro effect. And so whenever that starts, that towel really helps. And I found out, this is kind of a neat little weird fact, but sometimes they are running low in the hospital on pillowcases because they're full of hair from people losing their hair. So sometimes the linen, those are a challenge because it's something that kind of takes a hit whenever people are losing their hair. So it's something that you would never think of or understand unless you're there. Because, when they go, well, we're out of pillowcases right now. Like, how are we out of pillowcases? It's because they're treating people with chemo. Yeah. And so now when we go and they're like, well, we're kind of light on linens. I understand. Not a big deal. But anyway, so we came home. We raced the storm to get home. And boy, all we could do was we surprised our family, didn't tell anyone. We raced home because that's where we both wanted to be. And, navigating that whole thing, that was our first big thing that he went through. Mm-hmm. And I had to deal with setting up short-term disability and things like that. And that didn't really go like it should.
And that's a process in and of itself, dealing with all of this. It's one of those things that whenever you're diagnosed with cancer, you don't automatically think of as, going on short-term disability and, will my insurance cover this? Do I have special insurance to cover this? There's all that small detail things that is not your first thought when being diagnosed.
Right. And, and if you don't have life insurance, it's a lot harder to get it after the fact than before.
And a lot more expensive.
Yes, ma'am. And, dealing with the short-term disability thing, I learned a lot. And sometimes you learn a lot when things go wrong. And that was one of the situations. And they relied on the wrong doctors to give them the information needed. Not the doctors doing the stem cell transplant, but another doctor. And I don't even know how that doctor got in the mix. But somehow that doctor kind of was calling the shots, and we didn't know it, because that's the doctor that they were relying on, not any of his oncologists, not any of his team at MD Anderson, not the stem cell transplant doctor, not his multiple myeloma doctor, but another doctor back home. And so that was, that kind of changed things. And also, they were treating the stem cell transplant like a gallbladder removal. It's not like you go into the hospital on day 1, go out on day 3, and you can return to work on day 7. That was what was really wild to me, very eye-opening, because I kept having to explain that he can't be around people, no immune system. He's going to be in the hospital 3 to 4 weeks, and then he has to go, and back for follow-ups, and they just really kind of felt like he could go back to work while he had his follow-ups. Not possible. And to kind of tell you how messed up this got, he went back to work, I believe it was November 19th, a week after we got home. And his team wanted him back to work January 4th. About 6 weeks difference. But considering he had just had his stem cell transplant and gone through all of that, that was a very short time of recovery that he had.
Yes.
Now, in December, we both got sick. And so I think that was around Thanksgiving that we both got sick, and not something that should happen or was supposed to happen, but you can't plan those things, just like you can't plan not to get cancer. And and I tried hard. I did, certain foods, not certain cleaning products. I made my own. Like, for years and years, I was cognizant of, this is a carcinogen. I don't want that in my home. I don't want to eat a burnt hot dog weenie because that has carcinogens. I was cognizant, actively tried to prevent anything like this happening. Never, ever thinking that it ever would. But that's a different story. But anyway, so we got sick, but he got over it. His body was able to fight that off, really well. He did good. January. Can you believe he was already traveling again for work? And that is his happy place. That is what he loves to do, dearly loves to do. And so to be able to travel again for work, be gone overnight, was such a big feat. Hopefully beat cancer to the point of being in remission, and then now being able to travel again for work. But in January started all of the tests, the bone marrow biopsy. Well, the bone marrow biopsy was taken out of the wrong hip, so that had to be redone. But went back for MRIs and PET scans, and having to wait for that second bone marrow biopsy took a little while. And they're great to be very open and share those test results with us in real time.
And this is MD Anderson?
This is MD Anderson. And so I'm reading his bone marrow biopsy results, and I'm like, I'm reading things on here that I have never heard before. These terms, this terminology, I've not seen these words before. This leaves me perplexed. And honestly, a lot worried. Just because they didn't sound very positive. And we met with his doctors at MD Anderson, and she's like, well, it's kind of like residual amounts of the cancer being in there, but basically it's dormant. Not to worry. Not to worry. It's okay. That was January and February. And March, he was green and couldn't breathe and couldn't walk and was hunched over, just gasping for breath. Took him back to the initial doctor that found the cancer, and he said, "You need to go to MD Anderson. At the very least, you need to go to the ER here." Well, after being locked on a hospital floor, not being able to leave the floor, not having many freedoms at all, it's a hard place for him to go back to, is the hospital. And in the ER, they took him and they did a CT scan and they did a couple of other things. And they said words that I never thought we would be hearing, because we were, both boasting, "Oh, well, he's in remission. There's 3 different tiers of remission, and he's in the very best one." We just heard this 3 weeks ago from his team. Everything is great. They're like, "No, he has cancer." My first words were, "Prove it." Tell me his white blood cell count. Tell me this, tell me that. Prove it. I don't believe you. Yeah. And so his cancer had come back. He was no longer in remission. The stem cell transplant didn't work. And it doesn't work on some people. It just doesn't. His particular multiple myeloma is very aggressive. And he was hospitalized for a week here locally before we could get him back to MD Anderson. And the doctors realized then that the tests lie, the blood tests lie. They aren't accurate for him. You have to have radiology proof for him to see actually how he's doing. So all of that happened about a year ago. He came out of that short remission about a year ago.
And how long was that remission? Was it weeks, months?
It would be very easy to count in weeks. It was about 9 weeks.
9 weeks.
Of remission. It wasn't very long at all. He went through a whole lot to have a little bit of remission, but it sure did give him a whole lot of hope. Those weeks in the hospital, whenever his cancer came back, like I shared with you, one thing about cancer is it produces a lot of fear. When the cancer came back, we had to combat that fear and not let it come back in, not let it settle in and get comfortable anywhere. We needed to push that fear away, and it took some time. It was a battle. It was hard sometimes, but they came up with a plan, and it worked. And he was doing great. He was doing so great. 6 months of chemo, and then we were going to reevaluate and see where he is, and his numbers were looking better than they ever had since the cancer happened. And like I just shared with you, his blood tests, they're just not accurate. And right before the 6 months was up, on Labor Day, he went to sleep that night. No tumors on his body. Woke up the next morning, and he had like 6 tumors on his rib cage. And so that's kind of changed the battle for the last 6 months. We have been waiting for CAR-T. That is his next step, is CAR-T.
I'm going to pause you right here because we're going to talk about that a little later.
Okay. Things like that.
Yeah. thank you so much. I really appreciate you coming on and being the first interview. And remember, March is the awareness month for multiple myeloma, which is a cancer we've been talking about today. And Tina here as the caretaker, just make sure you let the caretakers know, people, that they are appreciated and loved, and make sure that they take care of themselves too, because they have a huge job. They have a huge job. So thank y'all, and I hope y'all enjoyed.
And also, I want to tell you thank you for inviting me on here, and because I know this is to your heart too.
Yes.
And thank you for allowing this opportunity to further the knowledge of this and just cancer in general.
You're welcome, and thank you. And you can always visit my Instagram and Facebook, and there is a link to the GoFundMe for Tina and Richard, and there is also an informational link to learn more about multiple myeloma, and that will stay up there permanently on my Facebook and Instagram, so y'all can learn more at any point and also donate if y'all see fit. So, thank y'all.
Thank you. Okay, sorry.
Hey everyone! So thank you for continuing with part 2. I can't wait for y'all to hear part 3. This is Megan signing off with Women of War Podcast. Don't forget to like, love, subscribe, comment, all those things. It really does help the podcast grow, and I would greatly appreciate it. Thank y'all.